Hello everyone, today we are going to talk about breast implantation. Women can get breast implant to make their breasts bigger and fuller. You may choose to receive breast implant following the loss of a breast due to cancer. You may be a healthy person who wishes to change the shape or size of your breast. If you are considering breast implants, you might wonder how to choose between saline-filled and silicone gel-filled implants. In this video, we will explain the different types of breast augmentation, difference between them, and how to implant the breast in general. Our role today is to answer most of our questions regarding breast implantation. Today, we have Dr. Park, who is a leading doctor at Ready Plastic Surgery. He is going to discuss with us everything about breast augmentation from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. So, Dr. Park, what is actually breast implantation?
Yes, breast implantation is a surgical procedure to enlarge the breast by inserting various materials between the muscle layer of the chest and the bones.
So how long does an implant usually last?
While there were times when every 10 years the breast implants needed to be changed, nowadays you may keep your implants as long as you do not have any side effects. If the breasts sag after implantation, we can perform a lifting procedure or change the size of the implants to adjust. There is no expiration for the implant itself.
So how do you usually choose the best implant for your clients?
One of the most important questions patients bring up when consulting for breast augmentation is what type of implant to use. When assessing a patient, chest width is very important in deciding what size of implant to use. Second, the cup size desired by the patient is key, and we need to know what the patient wants. For example, a C cup or B cup. So we choose the implant depending on the wishes of the patient.
So when can patient return to sport after the surgery?
Many patients tend to ask when they can begin exercising after breast surgery. If they had implants, at the earliest would be a month after, but after 3 months, any type of exercise is all right.
So is it possible to breastfeed after breast implantation?
Usually, there is no issue with breastfeeding after breast implant surgery. The mammary ducts and the breast implants don't interfere with each other, so there are no issues with breastfeeding. However, you must pay careful attention to any drug you might take after the implant surgery, as it can get into the mother's milk.
Is there any age limit for the breast surgery?
When performing breast implant surgery, if the woman is fully grown, there is no issue regardless of age. However, if the age is too old and the breasts are sagging, it can be difficult to make the breasts beautiful simply by the implant. So in such a person, we must do a lifting procedure simultaneously.
So for my last question, what are the most common side effects after breast surgery?
The most common side effect for those undergoing breast implant surgery is leakage in certain parts. However, leakage is not common. In reality, the most common complaint to doctors by the patient is the wrong sizes of the implanted breasts. So a patient may have wanted a C cup, but after surgery, she has a B cup. In these cases, the most common complaints deal with size mismatches relative to exceptions rather than leakages. So we can reduce the side effects if we operate after a thorough consultation.
Yeah, I guess that. Thank you so much, Dr. Park, for your time.
Thank you.
Today, the doctor explained in details everything related to breast implantation, including the different types and the cost of each of them. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.